If you're a spectator to a sport and you see someone who's had a concussion, please volunteer your help. If in doubt as to whether they've had a concussion or not, then sit it out. Be aware that any kind of fall, jostle, sudden head movement back and forth can be a source of a head injury. There's a wonderful statistic, and that is that 90% of people with concussions and mild traumatic brain injury will recover. However, 10% will linger beyond a year, maybe 2 years. So don't be misled by someone who has a concussion and thinking, oh, we don't have to do much, they'll get better. Most people do just fine. But in reality, many people suffer grievous consequences afterwards. And I don't like the word mild that's being used for mild traumatic brain injury. If you've had a traumatic brain injury, it's not mild, it's devastating long term. So while you've decided this person needs to sit it out for a while, gradual return to activity is very important. Don't just jump right back into the sport in which you got clobbered, but take time, reintroduce, and see how you do, see how your concentration is, your body movement, your anticipation of other things going on in the field. So rest and slow return to activity is very important. I have a message that I hope will apply to everyone, and that is if you're a parent and you have a child who's had a jostling event in sports and you may have had a mild traumatic head injury or a mild concussion, not only should they slowly re-engage in that activity, they should slowly re-engage in all activities. Reading, writing, paying attention in school, taking notes, processing speed, all of these can be affected. And just the demand on their cognitive resources and the low energy I talked about and the easy fatigability, these make those cognitive issues even much more difficult. So those also have to be taken into consideration. And if you're an adult, of course, getting back to the office, multitasking, answering the phone, having several meetings, you might be aware that you're tired, you can't pay attention, your mind drifts off after you've had a concussion. Take it easy, take it slow. Be careful and protect your head from any further injuries. As we moved into treatment and some of the things you can do for your client, many of them will already have had maybe chiropractic or other therapies before they get to you. But in the event that they haven't, let's talk about a few things that I would like you to consider and be as part of your clinical armamentarium as you work with head injury clients. They should, if they're having difficulty with coordination, balance, organization, occupational therapy can be very helpful. Physical therapy also for their balance, coordination issues. So occupational and physical therapy should be recognized as a very important intervention early on in a head injury case. If someone has lingering headaches or back and shoulder, other body parts problem, consider chiropractic care or osteopathic care. Craniosacral manipulation has also been found to be very helpful to help people return to full function. Massage, boy, massage feels great anyway, but if you have aches and pains and stiffness in your body, it just doesn't seem to let go, think of massage as well. Lastly, I'd like to emphasize the importance of nutrition. I'm not a nutritionist, that's not my specialty, but I recognize and have used and suggested many wonderful, capable people in the field. Naturopaths are very knowledgeable about many remedies and supplements that help support brain function. Make yourself aware of these and available them to your patients because that can support whatever they're going to be doing in your ILS therapies.